A very good evening, dear colleagues. First of all, I would like to express gratitude to the organizers of this symposia, specifically Professor Natalia Kurysheva, for the invitation to participate in this webinar. I would like to express gratitude to the colleagues who also were participating in this symposium, and many thanks to our audience. So the topic of my presentation today is personalized approach to the treatment and monitoring of glaucoma patients with comorbidities. Comorbidity is the existence of several conditions in one patient, which is related with the same pathogenetic mechanism or at the same time. So we see the connection of different organs and holistic organism at the level of neurohormonal regulation, macro and microcirculation. For example, vascular deteriorations that facilitate glaucoma and neuroopticopathies are studied for more than 150 years. For the older patients, arterial hypertension is including open-angle glaucoma. So some hypertensive treatments could influence central hemodynamics and the development of hypertonia and progression of neuropathy. The risk factors for comorbidities are chronic infections, inflammations, involution, systemic metabolic disorders, and iatrogenic and social status, ecology, and genetic predisposition. So the relevance of study due to a lot of data about the interorganic data in the patient organism, comorbidity could be genetically deteriorated or due to some other risk factors. The frequency of combined pathology in young individuals is 69%, while among middle-aged and elderly groups it reaches 93 and 98%, respectively. Speaking about posterior ischemic neuropathy, it is due to the development of stenosis of spine or carotid arteries. It's a pathology associated with ischemic impairment of blood circulation in the retrobulbar intraorbital portion of the optic nerve. Among optic nerve diseases, the incidence of ischemic optic neuropathy is 59.9%. Posterior ischemic optic neuropathology is a rare pathology in the optic nerve, which mainly affects people 50 plus. According to Hairer, in 11% of cases, posterior ischemic optic neuropathy is diagnosed in patients aged from 40 to 50 years. This is a rare, very serious disease that causes a rapid vision loss that can be associated with diabetes mellitus, hypertension, atherosclerosis, or it could occur after the surgery. The main symptoms include headache, periodic blurred vision, the appearance of blind spots, and the sharp decrease in visual acuity. Everybody knows about the stages of glaucoma treatment. So that's medicinal, laser, surgical, and we have to say that two steps, medicinal and laser treatment, could be replaced depending on the significance of the use. So in our practice, we also refer, and I would say even stage 4, which is neuroprotective step. Although all previous stages, all three of them, they have a particular grade of neuroprotection because they reduce intraocular pressure and we can appreciate it's a tolerant intraocular pressure. We would like to present you an interesting case of the female patient that referred to us in June 2023 with the complaints of a sharp deterioration of the vision in the right eye. Pain in the right eye was reported together with headaches since May 2023. The same month, she got a consultation with an ophthalmologist, but she doesn't remember the diagnosis. After that, she received consultation from neuro-ophthalmologist who diagnosed posterior ischemic neuropathy of the vascular genesis of both eyes. And she was prescribed medical treatment. And as a result of that, patient reported minimal changes, minimal improvement on the right eye. From her medical history, she reports that in 2020 she experienced COVID-19. So when he examined her, we see that the visus is 0.01 OD, OS it was 10. Intraocular pressure was within normal range. The optic disc OD is pale. The borders are moderately blurred with moderate prominence. The optic disc OS is pale pink. The borders are clear. So we had complete examination, microperimetry, ultrasound study, Dopplerography of the vessels of the eyes, head and neck. Here on the fundus pictures, you could see moderate edema that is confirmed by the studies of the posterior OCT. In the visual fields, we can appreciate that it was complete minimization on the right and narrowing on the left. So that spoke about particular deterioration around the optic disc. According to microperimetry, we reported complete reduction of the light sensitivity in the macular area, OD, and preservation of the sensitivity in the OS. So the studies, ultrasound Dopplerography, did not give us, didn't show us any changes from the vessels, both head and neck, also from the eyes. So the patient was diagnosed that was partial atrophy on optic nerve due to the posterior ischemic neuropathy. We prescribed neurotropic predystrophic treatment because posterior ischemic neuropathy, although the diagnosis still was quite doubtful because we couldn't confirm it by our data, by our studies. After neurotropic therapy, we again assessed supracranial administration of retinolamine. And then we were absolutely shocked by the results, and you can appreciate them here, which actually was confirmed the fact that possibly it was not posterior ischemic neuropathy, but it was sort of a transitory angiospastic status of the optic nerve. 1 month after the treatment, we got these data of the visual fields. Also, we had particular sensitivity in the macular area, especially OD. During next year, from August 2023 up to May 2024, the patients was followed up regularly with the controlling examinations every 3 months, and at the same time, all the visual functions were absolutely stable, as well as intraocular pressure, IOP. But coming in May 2024, we found out particular increase of IOP, especially in OS. When we estimated the tolerant pressure and targeted pressure, we got the data shown on the slide, which actually led us to the idea that we have IOP increase versus her own baseline data, and we prescribed selective laser trabeculoplasty in the upper half at 180 degrees. Control examination 2 weeks later after the SLT, we got the reduction of IOP in the right eye, maybe 8% from the initial, in the left eye, 9% from the initial. That led finally to the normalization of the intraocular pressure, keeping in mind her tolerant pressure. Here on the chart, you can appreciate particular dynamics of the changes of both IOP and other parameters, specifically BOP and ganglion cell, AVG, RNFL, and before the treatment, we report that there was some edema of the optic nerve, and it is confirmed by OCT. So, and regardless further treatment, we reported that there is a reduction of NFL density as well as GCC reduction,
В динамике
thinning.
в дальнейшем мы
In the
наблюдали
follow-up, you can
после
appreciate
первого
here,
проведения
after
СЛТ,
the
мы наблюдали
first
стабилизацию
selective laser
процесса.
trabeculoplasty,
Но
we
буквально
reported
через 9
stabilization. But
месяцев мы
then, 3 months
заметили
later,
повышение
we
мониторингового
reported
давления
increase
как
of IOP
со стороны правого глаза,
both
так и со
in
стороны
OD
левого.
and also in
Причем данные
OS.
мы
And in
получали
fact, we were
путем
getting
исследования
this
на
data
аппарате Корвиса с учетом
using
биомеханических свойств
biomechanic
релевиции.
assessment of retina, of
Спустя
cornea.
6 месяцев
So
после
6 months
проведения
after
СЛТ
SLT,
когда пациент
selective laser
обратился в ноябре
trabeculoplasty, one patient
2024
referred to
при
us in
включении
November
левой глазной
2024,
внутриглазного
we see
давления со
dramatic
стороны
increase of IOP
и правого глаза, и
both in
внутриглазного
OD
давления со
and
стороны
IOP
левого.
increase in
В
the
связи с чем
OS.
нами было
And as a
назначено
result, we
проведение СЛТ
prescribed
на площадь
SLT
270 градусов в правом
for
глазу и
20-70
сопредельную площадь
degrees
180
in
градусов
OD and
в нижнем
180
полушарии.
degrees in the
При
lower
этом мы
hemisphere. And then,
практически чуть больше 2 месяцев
2 months
получаем
later,
еще больший
we
скачок
got
в течение этих
even
2-7
higher rise. So
причем
during these 2
пациенты не
months, the
знали о
patients did not
сохранении
come to the
высоких
clinic, so we
внутриглазного
didn't
давления.
know the
В этот период
parameters of
был
IOP.
скачок до
So in that
давления до
period, we
44
appreciated
миллиметров в
rise
мерцфо
of
в правом
pressure
глазу,
up to
до 24
140
миллиметров
form in
в левом
the
глазу. И
right
снова
eye, and
проводим
then also increase in the left eye, in
в
the
середине
OS.
глаза
Again, we
проводили
performed
флюоропластику
selective
по
laser
усилению 180
trabeculoplasty
градусов с
in the
назначением
hemisphere of 180
ингибиторов
degrees plus
На контрольном осмотре
carbohydrate
через месяц
inhibitors.
мы
Control
получили
examination
незначительное
1 month
снижение
later gives us
внутриглазного
minimal
давления
reduction
правого
of
глаза
IOP on the right
и
eye
снижение
and
внутриглазного
also
давления в
reduction
левом
of
глазу, что
IOP on the
послужило
left
нам
eye. That was
поводом
actually the reason
продолжить лечение
to
и
continue
дополнительной
the
трансферальной
treatment
лазерной
in
терапии
the
на правом
microimpulse
глазу с
spiral
добавлением
laser therapy on the right eye,
ингибиторов
aiding
и с добавлением аналогов простагландина.
prostaglandin analogs.
На контрольном осмотре
On the
через
control
месяц мы
examination,
отмечаем
1 month
значительное
later,
снижение
we reported
внутриглазного давления со
dramatic
стороны
reduction of
правого глаза
IOP OD
и умеренное повышение
and
внутриглазного
moderate
давления со
increase of
стороны левого
IOP
глаза.
OS.
В этом случае мы
So in that
назначили
case, we
механическую трансферальную лазерную
prescribe
терапию уже на левом глазу
microimplants
для
therapy on
достижения
the left eye
толерантного
to
давления.
achieve
При
tolerant
контрольном
pressure.
осмотре
In
через
the controlling
4
examination,
месяца,
4 months
практически 2
later,
месяца пациент
within
не
4 months,
посещал
the
наши
patient
клиники,
again did not come to
мы
the clinic,
отметили
and
стабилизацию,
then we
относительную
reported
стабилизацию
the
внутриглазного
relative
давления
stabilization
и
of
со стороны
IOP,
правого глаза, и со
both
стороны
in the
левого
OG
глаза.
and also in
Мы
OS.
решили, что
And
необходимо
we decided
заменить
that
подход,
possibly we need to switch the
что
therapy,
в
and
последующем послужило нам
later on,
определенным
it
подспорьем,
was a great
может
help.
быть, подспорьем, но мы
It
заметили,
was a great help,
что
but actually
при
we
контрольном осмотре через месяц,
reported
что
that
даже после
in the
смены
examination
препарата
1 month later,
мы
even after the switch,
получили вновь
we're
скачок
still getting
внутригазного давления.
increase of
В
IOP.
сентябре этого года, когда
Then in
пациент был у
September
нас
this
на
year, this
контрольном
is a last
осмотре, мы
column on the
отметили
right, when the
повышение
patient came to the
внутриглазного давления
examination, we
до
reported the
34 в правом
increase of
глазу, до
IOP
16 в левом
34
глазу.
in the OD
И
and
мы
16
добавили
OS, and
следующую группу
we
препаратов.
switched her to the
На
combination.
сегодняшний день,
So
как
currently,
говорится, борьба с внутриглазным
we
давлением у
are
нас
fighting with
продолжается,
IOP, and the
несмотря
fight
на
is
то,
still
что
ongoing.
здесь показана
Although
определенная
here we
стабилизация со
appreciate
стороны
particular
костных
stabilization
тканей, как
from
живых клеток, так и РНФЛ,
RNFL
но
density and GCC
внутриглазное
density, but
нестабильное
still
внутриглазное давление, конечно,
unstable
требует
IOP
дальнейшего
definitely
изучения,
requires further
наблюдения
treatment, further
за данной
follow-up, and further
пациенткой.
studies.
Что хотелось бы отметить, что
So what I
коморбидности
would like
стадии
to mention
хронического
that
демента вследствие нарушения
comorbidities of
гемодинамики
vascular
зрения
genesis
могут
due
приводить
to
к
the
развитию
deterioration of
оптальной гипертензии в
hemodynamics
отсутствии
could lead
контроля
to
за
ophthalmic
неопределенным
hypertension in the absence of
Исключительную
control.
важность имеет
What
вовремя
is very
проведенное полностью
important is timely,
диагностических
complete
исследований
spectrum of
для
diagnostic
верификации
studies
диагноза,
for the
обозначения
verification of the
глаукомы
diagnosis
осторожности, назначения
and
адекватной
glaucoma
терапии.
awareness and
Атрофические
prescribe of
изменения
adequate
зрительного нерва в
treatment.
результате
Atrophic
оптики
changes of
вызывают
the
изменения
optic nerve
легких
due to the
связей
vascular
толерантности
changes leads
последнего,
to the
что
reduced
приводит к развитию
tolerance
глаукомных
and
процессов.
leads to the
Лазерное
progression of
лечение в
glaucoma.
сочетании с
Laser
медикаментозной
treatment in
терапией,
combination with
способствующей
medical
друг друга,
treatment due
обладает
to the
высоким
mutual
эффективным
potentiation give
эффектом,
us
достигая до
very severe hypertensive
75%
effect,
снижения
achieving up to
тонуса предсказуемого
75%
и
reduction of
должно быть
ophthalmic
применено
tone,
на ранней
and should be
стадии
used at early
диагностирования
stages
гипертензии. Персонализированный подход к лечению
Personalized approach to the treatment
пациентов,
and
перенесших
systematic
осложнения
monitoring of
из-за
patients who have experienced
является
vascular
ключевой
changes of the
основой для
optic nerve
предотвращения развития
is a key
глаукомы
foundation for
и при
preventing the
нем
development of
прогрессивной.
progression of glaucoma.
Благодарю за внимание.
Thank you very much for your attention.
Спасибо большое за интересное
Thank you very
сообщение.
much. Extremely interesting
И
presentation.
я так понимаю, что мы
And
сейчас
as far as I
перейдем
understand,
уже